few years ago, a man in his 40s sat down across from me, fit, no pain anywhere. He told me he felt fine, and he was telling the truth. I had his urine test in front of me, and it had been flagged 2 years in a row. He had kidney disease, and we caught it while it was still boring. Boring is the goal. That is the whole job. Here's why that man could not feel it. Your kidneys almost never hurt. They can quietly lose half of their function without a single day of pain. According to the CDC, 9 out of 10 American adults who have chronic kidney disease do not know they have it. 9 out of 10. But the kidneys do leave clues, small ones, in your urine, on your ankles, even in your toes. Today I will show you the 7 clues doctors actually look for. I am one of the doctors who reads those results. Hello, I am Dr. Water, a licensed physician in occupational and preventive medicine in Japan. Every year, as part of Japan's mandatory health checkups, I review thousands of urine and blood results from ordinary working people. Let me give you the answer right now so you are not waiting for it. The 2 tests you want are eGFR, a blood test, and a urine albumin test. That is it. That is the whole answer. Ask for those 2 and you have done the important thing. So why spend the next few minutes together? Because you need to know when to ask and what your body is trying to tell you first. And one thing before we start, if you are already on dialysis or already diagnosed, you know this disease better than most people ever will. This one is not about what you missed. It is for the people who share your blood, your brothers, your sisters, your children. They can be tested this month. Why are kidneys so quiet? Because they are patient workhorses. You have about 2 million tiny filters called nephrons. When some are damaged, the others quietly work harder to cover for them. No alarm, no pain. The damage just moves forward unless you look for it. So here is what to look for. Sign 1. Foam in the toilet that will not go away. A few big bubbles that pop quickly? Normal. But a dense, fine foam, like the head on a beer, that is still sitting there a minute later, again and again, that can mean protein is leaking into your urine. Healthy kidneys keep protein in your blood. Leaking protein is one of the earliest signs of a kidney damage, and it is completely painless. Now, let me be honest, because this channel does not do fear. Foam alone does not diagnose anything. Dehydration or a fast, strong stream can foam too. What matters is persistent foam, day after day. That deserves a urine test, not panic. Sign 2, you get up at night to urinate more than you used to. One of the kidney's first skills to fade is concentrating urine at night. So the night trips increase. Of course, there are innocent causes, age, coffee, and in men, the prostate. One night means nothing. A clear change from your normal pattern over weeks is worth checking. Sign 3, the color changes. Urine that is pink, red, or cola colored can mean blood. And that is never a wait and see sign. Sometimes it is a stone, sometimes an infection, sometimes something more serious. Any of those deserves a doctor within days, not months. In my checkup work, the urine strip is where kidney disease is caught first. The cost is almost nothing. It takes 10 seconds and it finds what you cannot feel. Remember that for the end of this video. Sign 4, swelling, especially sock marks that stay. Take off your socks tonight and look at a line they leave. A shallow mark that fades in minutes is normal. A deep groove that is still there after 20 or 30 minutes, or ankles that stay puffy when you press them. That can mean your body is holding salt and water or losing protein. Kidneys are one of the classic causes. Puffy eyelids in the morning, day after day, belong to the same family. Sign 5. Itching all over with no rash. This one surprises people. When kidney function gets quite low, waste products build up in the blood, and one result is stubborn, whole body itching, often worse at night with nothing to see on the skin. I want to be clear, this is usually a later sign, not an early one. If you have unexplained itching plus any risk factor I will mention in a moment, do not treat it with lotion alone. Get your kidney numbers checked. Sign 6. Tiredness that rest does not fix, and looking pale. Your kidneys do more than filter. They send a hormone that tells your body to make red blood cells. When kidneys weaken, that signal fades, blood count drifts down, and you feel drained for no clear reason. Now, the honest frame for all of these, every single sign has innocent causes too. What changes the math is the pattern, a sign plus a risk factor: diabetes, high blood pressure, heart disease, a family member on dialysis, age over 60. The CDC's own data says diabetes and high blood pressure drive most kidney disease in America. If that list includes you, the signs above stop being trivia and start being homework. Sign 7, the one almost nobody connects, your big toe, gout. That's sudden, burning pain in the big toe at 3 in the morning. Most people treat gout as a diet problem. Take a painkiller and move on. But high uric acid and the kidneys are in a two-way relationship. Kidneys clear uric acid. So when they slow down, uric acid climbs. And a high uric acid, in turn, keeps company with declining kidney function. In Japan, a gout attack earns you a kidney check. This should everywhere. And here's the trap inside the trap. The painkillers many people reach for, ibuprofen, naproxen, the so-called NSAIDs, can themselves stress the kidneys when taken regularly, especially in older adults or anyone already at risk. I am not telling you to throw away medicine your doctor prescribed. I am telling you that a few pills every day for years without anyone checking the kidneys is a quiet, common way to get into trouble. Ask your doctor or pharmacist. That one conversation is free. Now, the Japan part. In Japan, by law, every employee receives a health checkup every year, and it always includes that 10-second urine strip and a blood test. This system has been running since the 1970s. It is not because Japanese people love paperwork, it is because silent diseases need scheduled ambushes. Remember the man I told you about at the start? 2 years of flagged urine tests and not one symptom. The system found him. Let me put a number on that. In a study that followed 33,000 Japanese workers for 10 years, the urine strip was positive in under 1% and only a trace in about 3%. That is the whole harvest of a national program. Almost everyone hands in a normal cup and goes back to work. But here is the part that matters to you. The strip is very good at being right when it says something and very bad at catching everyone. A clean strip does not clear you. That is exactly why the second test exists. In America, no system is going to hand you that cup once a year, so you have to put it in your own calendar. In the United States, there is no such automatic net, which means you have to ask. Here is exactly what to ask for. 2 tests. Write these down. First, eGFR, a standard blood test that estimates how well your kidneys filter. Second, a urine albumin test, the UACR, which catches protein leaking years before anything hurts. Both are cheap, routine, and available at any lab. If you have diabetes or high blood pressure, ask for them every year. Now, 2 practical things nobody tells you. First, if you have diabetes or high blood pressure, your eGFR is probably already in your chart. It rides along on the standard blood panel. The one that is usually missing is the urine albumin. So the sentence to use is this: my kidney numbers. I would like to see my eGFR, and if I have not had a urine albumin test, I would like one today. Second, if you have no doctor to say that to, you are not stuck. Ask the pharmacist where you pick up your medicine. That conversation is free. Many community clinics run on a sliding scale, and if you pay cash at a lab, these 2 are usually in the tens of dollars, not the hundreds. And why bother at all? Because this is not 1990 anymore. Kidney disease that is caught early can be slowed down now. That is the whole reason the test is worth asking for. When the answer comes back, there is something to do about it. One more thing, write the number down. Then ask again. Next year, one number is a dot. Two numbers are a direction. So, your one action for today is not a superfood and not a supplement. It is a sentence. Let us recap. Kidneys fail quietly. 9 in 10 people do not know. The clues: foam that stays, more night trips, color changes, sock marks that will not fade, itching without a rash, tiredness with paleness, and gout in the big toe. Any sign plus any risk factor, ask for the 2 tests. This is general health information, not personal medical advice. For your own situation, please talk with your doctor. Next time, the sign of a failing heart that shows up in your socks first. Same time, same place. Take care.